Recurrent IVF failure and recurrent miscarriage can be very frustrating experience for the couple. It takes a couple a lot of courage to come forward for IVF treatment with all the hopes that it would be successful.
I did definitely have times, like in the middle of the night, where I think, oh my God, we're never going to have children, it's just never going to happen, and like be really upset about it. We had a good number of eggs, they were good quality, and I actually had a positive pregnancy result, but then it had a positive when I tested slightly early, and then it went negative, which is what led me to believe that it wasn't the fact that we were having a problem getting pregnant, we were having a problem staying pregnant.
It's very disappointing that many couples, before they come to us, they were told that they have just been unlucky and repeat the same thing again and again and again. Or some were told that forget about it, it's not going to happen.
We were having problems with a number of miscarriages, and then after that we were not able to conceive for at least 2 years, and therefore we came to the Fertility Academy to start the IVF process.
When the NHS weren't even going to entertain the idea of immune issues, we came to Dr Gorgy and he totally understood. He had a lot of advice. He basically prescribed a whole series of treatments which ultimately worked and were so successful that in fact we didn't need to do another round of IVF.
We looked hard and deep to find the reasons behind recurrent IVF failure or implantation failure and recurrent miscarriage. And we found that we can look into 4 areas. The first area is to test for immune system imbalance. We know that the immune system balance is very good for many functions of the body. Unfortunately, if this balance is lost, the immune system can adversely affect the functions of the body, making the environment not suitable for the embryos to implant, and this can end in IVF failure or miscarriage. At the Fertility and Gynaecology Academy, we are specialized in providing immune supported therapy. We developed a package of immune testing and we customize the immune supportive therapy according to the problem.
Dr Gorgy was very helpful and very caring and understanding in listening through or going through back to all my history to understand the cause of the problem, and detailed testing was done and research in terms of sending my results to Chicago for some quite innovative tests which I hadn't heard of, and we did something where maybe I was a bit nervous about, but he gave you confidence and trust that everything was going to be okay.
The second area of investigation is to look for infections, and we developed a battery of tests including looking for aerobic, anaerobic bacteria, mycoplasma, ureaplasma and chlamydia.
At some point we did consider whether it is worth it, and also at what point you call a stop, because you need to get on with your life as well, because it does take over not just physically but also emotionally. It's quite draining, and when you're working and you have stress, and it's just another added burden, and at some point, yes, you do say, where do we draw the line?
The next area of investigation is the uterine cavity where the baby is going to implant. It is important to exclude conditions like polyps, fibroids or scar tissues, because that has been found to affect pregnancy rate, and if removed, it improves pregnancy rate. At the Fertility Academy, we have many years of experience in doing cell line infusion sonography, often referred to as aquascan. Now this is quite a simple test which involves putting a small tube inside the uterus, injecting some saline, and then examining the uterus by ultrasound. It's a simple procedure and it's attended by little discomfort, and most people go home after it's done 5 or 10 minutes later.
The last area of investigation is to check the chromosomes of both partners, which we call karyotyping. We can also check the chromosomes in the sperm in case of low sperm parameters. If there is a problem with either test, We can check the chromosomes of the embryos created through IVF before we put them back. We only put back the embryos with the normal chromosome setup. This will obviously improve the chances of implantation and the chance of ending up with a healthy baby.
When Frederick was born, I guess it was just unbelievable, and both of us were quite emotional on the day as well, because we waited so long for it to happen, and for something we actually never expected to happen.
It is worth it in the end, that no matter how hard it is when you're doing treatment, you just totally forget. It's like, you know, it's difficult at the time, but you just forget about it. It's just worth it.
There is no guarantee for any sort of fertility treatment, but at the Fertility Gynaecology Academy, with the extra tests and investigation we do, we find that we have given a lifeline to many patients who have been told to have no hope.
Yes, there will be points where you think it's not worth it, but the Academy has a fantastic reputation. It certainly helps me when I really thought, you know, nothing could ever be done. Don't be scared of trying out new things, because I was certainly very skeptical about certain things that were suggested, but it worked. So give it a go.
Many of them really have come to the end of their treatment journey, and now they end up being successful with babies. I mean, I can show you many cars. One patient who have been through this journey for 12 years. I thought it would never happen. Now I can't believe that I have a baby in my hands.